The PA and NP professions are growing, and we are becoming such a major force in healthcare today. And that is fabulous. But I do have to say that there are some problems with our growth, and especially in the PA profession. And that has to do with diversity. The profession is overwhelmingly white, and that can be problematic because we have a huge diverse patient population and we need to see that diversity reflected in the providers that take care of the patients. So, my guest today has been heavily involved in the PAs for Latino Health organization and cares deeply and passionately about Latino health in general. She's going to tell us some of the barriers that are keeping Latinos from entering medical professions like PA, but she's also going to talk about some of the issues and concerns that Latinos have about accessing health in general. So, if this is something that is interesting to you, then please stay tuned for this great discussion.
My name is Paola Gonzalez, and I am a physician assistant. I have been a PA for over 20 years, and I am currently the president for PAs for Latino Health.
Great. Well, thanks for joining us today. Tell us a little bit about why you got into medicine to begin with.
So I am originally from Colombia. So coming to the United States as an immigrant, like I knew I wanted to be able to help people. And healthcare always seemed to be a very genuine place for me to go. So I had been in pre-med, and then my high school physics teacher, he's the one that told me about the PA profession. So thanks to him, here I am. But I've loved it all along the way.
Yeah, great. And so tell us about your involvement with PAs for Latino Health.
In 2021, I heard about PAs for Latino Health by attending the virtual AAPA conference. Believe it or not, I had never heard of them before. So I joined them at that time as their membership and public relations chair.
You said that you are currently serving as president of that organization. Is that correct?
So over time, like my roles just kind of expanded. The thing that I figured was most important was that people didn't know about who we were. And so we really started working a lot on our social media presence, making people more aware of who we were. And we really expanded. When I started with the organization, we were around 70 strong, and currently we're close to 500. Wow. So it's really been a great exponential growth, and it helps us because we're able to expand on what we're trying to do. And so from there, I went on to being president-elect. I wanted to really get involved in the logistics and what we were doing, and currently serving as the president. So now that I've been working through my leadership with PALH, I recognize the ability to really expand on that. And so I've decided to launch my candidacy for AAPA Board of Directors, Director at Large. My goal is to really kind of bring my initiatives and my ideas to AAPA to expand on student leadership opportunities and mentoring, harboring more of the early career mentoring opportunities for leadership and guidance. And then more so, again, continuing that diversity mission of, really increasing access to healthcare, as well as increasing minorities across the board into our profession. So I would love the opportunity for anyone interested in learning more to, reach out. I have a candidacy website, and vote. Please exercise your ability to vote.
So, talking about what PAs for Latino Health actually does, tell us about what the organization does and their mission.
So, our mission has been to serve our community. We do this through education to providers, education to the community. Our biggest mission is to increase diversity within the profession through mentoring, through providing educational opportunities, through scholarship. And so that's kind of been our biggest endeavors, is really focusing on helping the next set of leaders while educating our community about who we are and educating others about the adversities in healthcare that our community faces.
So, talking about PAs, Latino PAs, do you have figures on how many there are in the United States?
NCCPA has done a pretty good job of evaluating the percentage of PAs that are of Latino or Hispanic descent, and we're slowly growing. Originally, we were around 3 to 4%. We grew to 5% in 2020, and most recently, I believe we're at 6.8%. So little by little, we're making a contribution, but when more than 20% of the population in Texas alone is Latino, we could do better. And so that's kind of our biggest initiative.
Okay, so what are some of the major obstacles that you think are in place that keep Latinos from becoming healthcare providers?
So I think one of the big key things that I have seen, and that is a broad concept that's not just affecting PA students or potential PA students, but also PAs to be supported by the community, is that we've done a not so great job of educating the community on the Latino side, on the Spanish speaking side, who we are. They don't know what a PA is. This profession
Uh,
doesn't exist in our communities. It doesn't exist in my home country. So when I go back to Colombia, it's really difficult for me to explain to them what exactly it is that I do, and try to make sure that they know that no, I'm not a doctor. It's something different. So I think that
but you're not a
that's
nurse
one.
either.
Right. I'm not a nurse. I'm
And
not
you're
a
not a
medical
medical assistant.
assistant.
Yeah.
But I think that's one thing that is difficult is that in the community we know nursing, we know doctors, but Latinos don't know what a PA is. So
Um,
thankfully, that's one thing that last year we started to really focus on and really getting more of that media marketing out there. And AAPA has really been great about collaborating with PALH recently on creating some content. We started around the time with Harris Paul and creating some Spanish speaking content, introducing the information to the community via radio and TV. So I think that's one barrier. The second barrier, I think, is resources. Our communities many a times don't have the financial resources to provide a student the abilities to get coaching or to get mentoring or to go to great schools. I know I, for myself, when I came, I had no college fund. I had no one to guide me on the FAFSA or how to apply for college. I was the first one in my family to attend college and working full time. Like I worked all the way until I got into PA school and then took out loans just to support myself because at that point in time I was no longer living at home. So I think
okay.
financially there are some barriers that our students face and that they don't have the same resources as some other members of the community.
Yeah, and I imagine too, if you don't see a lot of role models around you in your community, that it's not a path, that you even know of to follow. So talking about the Spanish language, I covered this in my video about Puerto Rico, about PAs in Puerto Rico, and I'll put a card up there if anyone's interested in watching that video. But they talked a little bit about how PAs are supposed to introduce ourselves in Spanish. Can you tell us again what the proper way is to introduce ourselves to Spanish speaking patients?
PALH worked very hard with AAPA on making sure that we had a formal adopted translation for our title, which actually works out great now since our title change. So physician assistants or physician associates should be saying asociado médico. It is a gender neutral term, so we do not need to conjugate it into a feminine version. So if I walk into a room, I'm going to say, hola, soy Paola, soy tu asociado médico.
I have started to use that, which has been nice to be able to. I can't say much more
Yay.
than that, but at least I can introduce myself correctly. So that's good to know. So, what are some of the barriers that you think Latino patients face when they're trying to access care?
So there's two barriers that I see that are the most difficult barriers for our community. I think one is access. We know that many a times our community doesn't always have the PTO to go to the doctor's appointments. They may not have the transportation to go to the doctor's appointments or a family member to go with them sometimes, especially in our elderly patients that may not drive. Like my grandmother does not drive, so we have to have someone take her to the appointments.
Mm.
So I think that's one. It's just some of those determinants that happen just because of the lifestyle. And then the second one is barriers in language. I think that's one of the biggest things that I advocate so much for because I know, for example, for my own dad, he speaks English fairly well. He's lived there now since he was in his 30s, but he still does not feel comfortable seeing a provider in English. Like he'll call me on FaceTime and like, Mommy, can you listen to what they're saying? Because I don't understand. And I'm like, Dad, he's saying this. I know you know this English, like, but I know, but it's not conjugated in my brain. And
Yeah.
so I think that there's that barrier there. And I can give you an example. In my own practice, I had a patient that even with a translator, they were coming from the valley and had been seen by a specialist, had been given all the information via translator. But I think sometimes there's this disconnect between
Mm.
when you're looking at that provider versus looking at the translator or listening to the translator and kind of processing all that. And she had been given all her information and she showed up to my clinic and she was like, I don't want treatment. And I'm like, why? She's like, I don't trust it. So there's that mistrust of not knowing if they're doing the right thing, even though in general, Latinos are very trusting of the doctor. If the doctor said it, do it. But I think there's this also kind of fear that they may not be doing the right thing. And it took me like an hour and a half of me talking to her in Spanish, giving her the exact same information
Yeah,
that they had given her. But there was that source of trust between that cultural understanding. Like she knew where she was coming from. We got the
good.
aunt and the brother and the sister on the phone, and I think that's the inclusivity that sometimes as Latinos, because we are so family oriented, we want the buy-in from the whole family and that culture aspect. And so
Mm,
I think those are things that we as providers can definitely mitigate to a point. I know not everybody's going to be able to speak Spanish, but I
good.
think the more that we can connect to that culture and that fear, the more we can overcome it.
Going to the doctor or any healthcare provider that you're seeing, even when they're speaking your own language, you often come home with more questions and are, are not sure about what they were saying. I can't imagine having it go through a translator and then coming home and wondering, did they really understand it? Was it translated correctly? Did I miss things and stuff? So I see that's another level that it's difficult for people. And so I guess that my next question was going to be why you feel like diversity is something that's really necessary in medicine, but that's a great example right there. Do you have any more things you want to say about that or other examples?
Yeah, so I think that the importance of diversity for the healthcare profession as a whole is that in general, the patients will be more trusting and are going to probably follow through and have better patient outcomes because they believe in the system, they understand the process. But we also know that there's actually research that shows that even just having a diverse healthcare provider, even if that's not the provider that treats the patient, already has shown that it has better patient outcomes for that community center that is involved. So there has to be some correlation by having greater diversity. There's going to be more awareness for the community, whether it's the Black or Brown community or the Latino community, that we know that we're seeing better outcomes overall just by having that representation.
There's just something about human beings that we connect with people that are more like ourselves and like you said, understand our culture. So definitely important in all communities. So what are some of the things that you're seeing out there for diversity initiatives or laws, good or bad, that are out there right now?
For a while there, we were doing really well with DEI initiatives from 2020 on when we had a lot of political and social disruption in that time period. And so we were really making some great gains. Unfortunately, most recently, we really had a lot of anti immigration, anti Latino policies starting to arise. And that's one of the things that we've been advocating and working against at a state level. So, as an example, in Florida, there was some legislation that was passed that required providers to ask immigration status at an emergency department level. And where that is impacting our community is we know that when we look statistically, the grand majority of people that end up in the emergency room are your pregnant ladies. And so they normally are not having good OBGYN care because they don't have insurance. And so when they show up to the hospital, it's because they're in labor. And so if we're going to have that as a barrier, it could lead to worsening maternity health, worsening infant risk of complications. So that's one barrier, right, that we're seeing in that community. And then we've seen it kind of spread out into other areas and spaces in other states. Here in Texas, an example, we had at some point in our institution, we had DEI champions, and those were taken away by a recent legislation change. So it's trying to make sure that we understand that in healthcare, diversity is important, equity and inclusion is important, but it's not meant to be in a political aspect, but more from a healthcare perspective of understanding how these things affect patient care and patient outcomes.
Yeah, and I know immigration is a complicated topic. We just can't go move other places, and people can't just come to our country also. And there has to be some things that immigration is done through certain channels, but that's politics, right? That's
Right,
like you were saying, for the state to handle. When you're talking about medicine, I mean, you can't just turn people away. Human beings is a human being and they need medical care. If they need medical care, they need medical care, right? And so
right.
it's up to the politicians to find other ways to, I believe, to figure out the immigration concerns and but to allow people to be able to get health care when they need it.
Absolutely.
It's
We didn't
fun.
go into politics. We went into healthcare. So we went in to help
Right.
people. And like they're already
Right.
here. Like I would feel terrible to not be able to help, someone just because of their I don't want to know. I want to know what's
Right.
wrong with you and how I can help you and how
Hmm.
I can
Yeah.
heal you, not how did you make it across the border, and that to
Right.
me I think it as an immigrant myself that has gone through the immigration process and has had family have to wait up to 20 years. Like my brother took 20 years to get his
Well,
immigration status through me. I do think that that's something that the politicians need to, work on, but that's not my goal. My goal is to
right.
help the people that are already here and to make
Yeah.
sure that we don't cause harm, right? It shouldn't matter what color, what ethnicity, what race, like we should all be able to help each other in medicine. And that's the
Yeah.
purpose of why we're here.
Yeah, I mean, as healthcare providers, we're charged with helping anybody. I mean, if you have somebody come in the emergency room who just shot several people or did something horrible, we still treat them. They're a human being and calling. And I'm not equating immigrants with
Oh,
lawbreakers. I realize
No.
as I said that. I just meant that that's just the most extreme example I could think of how we're supposed to detach ourselves from anything but the medicine, that we're just supposed to focus on the person and their health, and everything else is up to other people to figure out who have chosen other professions, right?
Correct.
Okay, so let's talk about PALH's membership and what that offers to people. So if somebody is watching this and wants to be involved, do they need to be a PA or can they be PA students, those kind of things?
Sure. So we have a pretty diverse cohort of members. So we have PAs that are either fellow PAs, meaning they're fellow members of AAPA and PLH. We have the senior members, which means that they are members of PLH, are PACs, but are not necessarily part of AAPA. We have physicians that are also members. We have graduate students that are just passionate about health advocacy for the Latino community. We have PA students that are in both clinical and in their didactic year. And then we have pre-PA students. So it's a pretty diverse cohort of members. And so trying to make sure that we are able to assess the needs of our members and really kind of target that. And so we try to do that in various ways, whether it's through medical education, CME, that's included in our membership, or whether that's through mentorship, or whether that's through scholarship.
Do you want to talk about the scholarship a little bit more?
Sure. So our scholarship was started early on because we knew again the financial impact that we know PA school has for our community. And so initially it was a lot of self-funding from members themselves, but we were able to garner this collaboration with NIH, AAPA, and PLH. And now we created this program where through this collaboration with Canopy Medical Spanish, whenever somebody goes through our link, they get a 20% discount to the program. One, they get 45 CME credits category one, so they can use CME funds. They learn Spanish. They do not have to have any Spanish background to get that program. And they will be able to gain enough information to speak to their patients about medical conditions, not necessarily be fluent and go out clubbing afterwards and
Right.
talk in Spanish, but they'll be able to communicate with their patients effectively. So that benefits our community. Then 20% of those proceeds from that sale actually comes back into our PA Foundation Scholarship Fund. And it's through those funds now that we're able to give anywhere in the past couple of years, it's been 5 to 7 scholarships. In the past before that, it used to be 10 to 15. And so the benefit of that is not only are we then providing greater medical Spanish providers out there to the community, but we are now supporting a diverse PA student cohort. And the scholarship itself is focused on students that they don't have to be Latino, but they do need to be having good grades. They have to be involved in the Latino community and show how they're involved in our community. And so then once they receive the scholarship, they do have to stay as a member and be actively engaged in our, committee of some type.
Yeah.
So we have several committees to kind of give back some service and provide support to the organization as a way of a thank you for the funds that they receive.
And so what kind of legislative things are PALH working on?
We have been working with several different organizations supporting different initiatives. So one of the biggest things that we've done over the past couple of years is whenever we see that there's legislation that's going to impact the Latino community in whatever kind of state, because we have members from all over the United States, then we actively, one, advocate for it in our social media. We have our Chisme Tuesdays or Chat the Tea on Tuesdays. And our goal is to bring more awareness about that particular legislation so that people, one, will join the state chapters and advocate for change on that. But two, call up your legislator, call up your representative, because this is going to impact your tia, your tío, your family member, or your actual ability to practice in that state. So that's one way we've done it. We've also been collaborating with the National Hispanic Medical Association and getting more involved in different leadership networks. So I just attended a leadership summit with the National Hispanic Medical Association on finding initiatives to support our community. So really starting to create those strategic partnerships to make the effective change.
Where do people find, if they want to get more information about joining, where do they find you both online, and are you going to be at AAPA this year?
We usually love meeting up at AAPA. We do that annually. We have our board meeting, our general session. Though one of the things that I failed to mention is we also created a student alliance. And the student alliance is unique to our organization in that we created a full leadership board for them. And so they run it, they decide what initiatives they want to work on. We fund their initiatives. And so they have been really growing, and they have their own monthly meetings, and it really drives that leadership aspect and getting involved in the profession and also supporting each other. So they'll also be at AAPA, but you can also find us at our website, www.palh.org. And we're also on Instagram, we're on LinkedIn, we're on Twitter, X,
Good.
at Asociado Médico. So yeah, we would love to have people that are involved and engaged in the Latino community. Again, you don't have to be Latino to be part of this.
Good.
And membership is really not super expensive. It does include a monthly CME category one that we provide. We started our pre-PA mentorship program that's actually
Oh,
backed by HHS and Secretary Becerra. And we started with them in September of this year, of 2023. We started with a cohort of 35 students, and already 6 have been accepted into PA school, and we have about
great.
10 to 15 that are applying once the cycle opens now. So our goal is really to kind of put, our money where our mouth is and say, we are going to get these people through, right?
Yeah, that's awesome, because I know there's a lot of pre-PAs out there that are always looking for somebody to give them a little guidance and help along the way. All right, Paola, anything else that you want to tell us about Latino health or PAs for Latino health?
I'm very passionate, as you can see, about our mission and our organization. And I just want to make sure that people are aware that we're very open to collaborating and partnering with other organizations, with other chapters. We want to support you. We believe that the best way that we can help our profession is to advocate for our profession, but more so to really engage the Latino community, because we feel that if we engage the Latino community, we get their buy-in in legislation through their representatives, we can really push our PA profession forward.
Great. Well, thank you so much. I appreciate you taking your time to tell us all about this very important topic.
Thank you.
Like I mentioned earlier, I've already done a video about the PA profession in Puerto Rico and what is happening there, why there's a PA school, but PAs can't actually practice in Puerto Rico. If you're curious about that, check it out in this video here. I'll also put the playlist here of videos about PAs working all around the world. Thanks for joining me, and as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.